Hi everyone, and thank you for coming. This poster is about a very rare genetic disorder called Weiss-Kruszka syndrome that is caused by mutations in CNF 462 gene, deletions, or even translocation in this region. As you can observe in the schematic representation of the gene, it has two main domains. The green one that interacts with PBX1, which is a transcription factor of the Omebox family that is involved in several developmental processes. And those that are in yellow representing fingers that are involved in chromatin remodeling and heterochromatin modification. The prevalence of this disorder is known, as only 29 patients have been reported to date. Most of them are de novo, but there are a few cases of autosomal dominant inheritance. In this study, we report the first case of Weiss-Kruszka in a Hispanic Mexican patient after molecular studies revealed a deletion in the chromosome 9, encompassing 7 genes, among them CNF 462. This is a case of a 9-year-old patient who presents psychomotor retardation, generalized hypotonia, scoliosis, bilateral ptosis, epicondral folds, and learning difficulties. In this study, we also attempt to establish a genotype-phenotype correlation for the genetic variants, given that there was not a clear one, which is very important for diagnosis purposes. And the comparison of all the clinical manifestations across all the patients reported today highlights some of the most prevalent characteristics observed in Weiss-Kruszka, with ptosis being the most common across all the patients, followed by the developmental delay, hypotonia, speech and motor delay, epicondral folds, arched eyebrows, among other dysmorphic craniofacial features. We also review all the genetic variants, deletions, and translocations to better understand the mutational spectrum of the gene. And we realized that those patients with deletions or translocations were more severely affected than those with punctual mutations. Thank you.